Today in the Portage Health Foundation Addiction Series, we're looking optimistically at what our community can be and what's already being done to combat the effects of addiction in the Copper Country. I'm Sarah Blakely, TV6 Morning News co-anchor and your host for this series. You'll hear many voices in today's episode. Rebecca Crane from Dial Help, Bernadette Yeoman-Ouellette and Kevin Storr from the Portage Health Foundation, Nikki Collins, Houghton Chief of Police John Donnelly, Mark Maggio with the Phoenix House, and Dr. Adam Frimodig from UP Health System. The search for answers is still on, but this insight provides a vision into the future for how addiction is being addressed in Michigan's Upper Peninsula.
I think early intervention is really critical, and that's why I'm excited about a lot of the youth-focused things that Portage Health has been doing and we're trying to do. I think also just more service providers in general, that's probably the biggest thing, especially for youth, and I would say for women. We don't have transitional housing, for example. When people get out of treatment, they have to rebuild their life, and there's not sort of that in-between step of safety and rebuilding. So some of those, I think just addressing some of those critical gaps that we have in service provision would be huge.
From the limited amount of research I've done on solutions, looking at immediate solutions on how do you treat addiction, I think we can do much better in this community and how we treat it. I think we have to be open to medication-assisted therapy. That's a pretty controversial method to work with addiction, but it's been proven and it has one of the best success rates. So I think we need to start broadening our outlook on how best to deal with the addict. I think there are many different reasons why people become addicted. I think what we're seeing more of today are people who have become addicted as a result of prescribed medication. I believe we have to further educate our physicians on how best to deal with pain management. And pain management doesn't always have to mean an opioid. There are other methods that we could be utilizing.
We need to have a lot more yes and conversations. Yes, that's a solution and we can do this. Yes, that's a good idea and we can do this, as opposed to the partisan conversations that have been happening so far that keep us from coming together in those common areas and really being able to move that forward and move some solutions forward. That's what I think needs to be a good starting point.
We need a community detox. And what I mean by a community detox, I think that everybody making a conscious decision every day of how you can help out. How can you help your neighbor? How can you help that sick, addicted person? There's a lot of people that are in recovery or trying to stay in recovery that don't have a driver's license that need to get to a recovery meeting or, those kind of things. Getting out of yourself to help another.
Try to be understanding if somebody does have an addiction problem. That doesn't make them a bad person. Most people don't say, I want to grow up and be an addict. Try not to be judgmental on that part. And then, but try to be open-minded that it can happen.
People present with much more than just the substance abuse problem here. They have life problems. They have employment issues. They have relationship issues, health issues, mental health issues. And treating the whole person simultaneously, to me, seems to be the best practice.
It's getting rid of a lot of these barriers that are here. It's getting people into the places where they can get the care that they deserve. It's having medical professionals to be aware of this and know either how to help themselves or help their patients directly or where to get them the help that they need.
To sort of become educated and also to, in a non-judgmental, non-stigmatized way, encourage the people in your life to reach out to us, the Phoenix House, all the providers, because treatment is available and we can help them get connected to those things.
There's a strong recovery community up here that are willing to help. People just need to take that first step and, people are here to help them out after that point.
The community needs to be aware, acknowledge it, and create awareness within themselves, to learn about it, understand it, talk to their children. Don't be afraid to raise those questions. And I think that's one way the community can really get behind this and be part of the solution.
Thanks to all those for sharing your vision for a better future dealing with addiction. We hope you'll consider these things for your future and consider how you can be a part of the solution. In episode 10, we'll look at the overarching effects addiction has on the entire community. If you or someone you know is struggling with addiction, know that there are resources available in our community. Dial Help is a great place to start. They have a crisis line 24 hours a day, 7 days a week, based right here in the Copper Country. Just dial 906-482-HELP, text 90635-NEEDS, or chat live with someone at dialhelp.org. If you're in any kind of medical emergency, dial 911 immediately. To learn more about the resources available in our community or to subscribe for email alerts for future episodes, just visit phfgive.org/addiction.